Hi, I'm Cynthia Dickstein, and you are watching Political Perspectives. Thank you for joining us as we address an issue that is of great importance to each and every one of us, without exception. Tucson recently held a two-day conference on the health effects of climate change, hosted by the Arizona Health Science Center and financially supported by many organizations and individuals throughout the community, including Access Tucson. One of the two conference keynote speakers was Dr. Jeremy Hess, who is with the National Center for Environmental Health, Centers for Disease Control. We are pleased and privileged to have Dr. Hess with us today to talk about climate-related health problems, what they are, and what we need to do to face the challenges they present. Dr. Hess, welcome. It's great to have you with us today.
Happy to be here. Thank you.
What would you say now to those few people left who still maintain that there's no such thing as global warming and climate change, or if they do admit that there is, do not admit that human beings' activities have anything to do with it?
Well, the climate record shows pretty unequivocally that there has been significant warming. The last 11 of the last 12 years have been the warmest on record, and thousands of studies literally have shown with great concordance that there are ecological changes consistent with warming, and then also changes in the water cycle, the hydrologic cycle, that are consistent with a changing climate. And we're seeing it all around the world. The evidence, from my perspective, is quite strong. And I think most skeptics have come to acknowledge that. They concede that the record shows that there is significant warming occurring. In regards to the cause, there certainly are several things that affect the Earth's climate, but we see a very clear correlation between carbon dioxide emissions, primarily from combustion of fossil fuels, and with the warming trend. And the computer models we've generated to study the Earth's climate show that if you take out the influence of the atmospheric carbon dioxide that's been emitted, that the Earth's climate would have behaved very differently than it has behaved in the past roughly 15 to 20 years. So there's pretty strong evidence that those emissions are driving the climate changes we're seeing.
Mm-hmm. So these emissions that you're speaking about and these greenhouse gases, how does it work exactly in lay terms? How is it making the globe warmer? What happens?
The Earth's climate is regulated within a fairly narrow range by the atmosphere primarily. So the sun emits radiation that penetrates the atmosphere. The majority of it is transmitted through the atmosphere and lands on the Earth's surface and warms the surface of the planet. And the radiation is then transformed into heat, and some of it is re-radiated as infrared radiation. And this radiation then is reflected back to the atmosphere, where the upper atmosphere warms somewhat and re-radiates some of that energy down and reflects that energy back to the Earth's surface. Not all of it, but some of it. And the balance of gases in the atmosphere affects how much radiation is radiated back to the surface. And increased concentrations of certain gases, such as carbon dioxide, methane, water, nitrous oxides, and others, affects the rate at which the warmth is re-radiated back to the Earth's surface. So as carbon dioxide concentrations have gone up, as methane concentrations have gone up, we have more re-radiation of energy from the Earth back to the Earth's surface, and hence warming.
Mm-hmm. And what are besides the temperature, what are the visible signs and changes that we're seeing already? I mean, something like severity of storms, more flooding, things like that?
Well, we're seeing several changes, and they're all driven by increased thermal energy on the Earth's surface. So we're seeing increased what we call ambient temperatures at the Earth's surface. We're seeing increased temperatures in the ocean, on the surface of the oceans as well. We're seeing changes in the hydrologic cycle, which is the cycle wherein water evaporates from the oceans, goes into the atmosphere, and precipitation comes down in the form of snow and ice and rain. And we are seeing as a result of all of these changes, which are more pronounced at the northern latitudes, we're seeing changes in ecosystems, we're seeing movement of plant and animal species, and we're seeing more severe storms, we're seeing more severe and longer heat waves, and a host of other ecosystem changes around the world.
Mm-hmm. And these would lead eventually, I'm assuming, to famine, food shortages and famine, I guess, unemployment, migrations. I don't know, I'm sure there's a whole list of things that will affect people, that will ultimately affect their health.
There are. There are several environmental effects that have garnered the world's attention over the last several years, and the plight of the polar bears and other ecosystem effects. But where the rubber hits the road is the human health effects, in my mind. And there are several direct health effects and several indirect health effects. The direct health effects have primarily to do with the hazards that climate change brings. So increased temperature, increased extreme precipitation, and sea level rise. And then indirectly, there are several associated events, mass population movements, the potential for widespread malnutrition, basic fundamental disruption of some of the patterns that we've come to rely on that affect us in terms of our security economically, and also in terms of our health.
Mm-hmm. Now, right now, where would you say is the worst spot on the planet? I know that sea levels are rising in the Marshall Islands and the South Pacific Islands. Are they the canary in the mine, so to speak, or are there places suffering more?
Well, obviously there are lots of different places around the planet where there's immense suffering, and not all of it is related to climate change. Mm-hmm. Places where the effects of climate change are most manifest are in the northern latitudes, so the Arctic, and then also places that are low-lying, islands, coastal areas, wetlands. Desert regions are also significantly at risk. Mm-hmm. But also wherever you have concentrations of vulnerable populations, so disempowered people, poor people, often people of color, those populations are more vulnerable to environmental hazards. So particularly in cities, we see a lot of the health effects of climate change concentrated. So there really are quite a few different places where people are at risk. Mm-hmm. We do see dramatic changes already in Alaska and other parts of the Arctic. We're seeing sea level rise in certain islands. You mentioned the Canaries, Kiribati, other areas that are anticipating they'll have to relocate their entire population in order to continue. Mm-hmm.
I think I read that Bangladesh is expected to lose 1/6 of its land mass due to sea level rising. It's a lot of people to be displaced, and a lot of diseases that would be carried to cities based on poor water supply, I guess. And I mean, it's a frightening thing to think about, but the disease level, which is your specialty, there are many different diseases that are expected to increase. The easy one for me is mosquitoes, because I hate them and they love me. So I think of them first, but aren't they going north, more northerly, and so won't what traditionally are more colder areas more apt to have mosquito-borne diseases and illnesses?
Potentially. It depends on the disease, and it depends on the vector. There certainly
vector, would you describe vector in case?
The vector is the insect that transmits the disease. So ticks for Lyme disease, or mosquitoes for dengue, or malaria, for instance. So the ecology of infectious diseases is quite complicated, and each disease has its own specific ecology. So it's difficult to make blanket statements about all of these diseases. We are seeing warming increasingly in the northern latitudes. We're also seeing warming as you go up in elevation. So, for instance, parts of Africa that where malaria was not around year-round, because the elevation was high. And there are several cities in Africa where there's not a lot of malaria currently because they're at higher elevations. There's concern that with warming at those higher elevations, we'll see more malaria in those regions. Conversely, in the United States, we already have mosquitoes that can transmit malaria. Malaria was present here in the late 1800s.
Especially in Tucson.
The Centers for Disease Control was put in Georgia, was that it was a focus for malaria. So we have potential for those diseases in the United States already, and those vectors are here. They haven't gone anywhere. But we've eradicated diseases through several preventive measures. And so strong public health activities can keep those diseases from spreading, though they may be knocking at our door more regularly than they have been in the past several years as a result of climate change.
Is one of the ways to measure this wildlife monitoring?
It is, and again, for different diseases, you do different types of surveillance. But one of the things we do for West Nile virus, for instance, is we monitor for dead birds. And then when there are clusters of dead birds, we test them to see if there's West Nile virus in the populations that have died. And that's an early warning system of sorts for a West Nile epizootic, which is an outbreak in the animal population. And so we can monitor, there are all sorts of different kinds of monitoring we can do of animal populations. For instance, here in Arizona, you can monitor rodents to look for hantavirus. You can monitor their excreta to see if they're excreting the virus. So
sure. I think we all know that America is lagging behind in this. Where in the world are they making the most impressive moves towards controlling emissions and global warming?
It's an interesting question. And, you know, in terms of climate change, there's mitigation and adaptation. And mitigation is what I think you're speaking about, which is efforts to minimize greenhouse gas emissions, reduce greenhouse gas emissions, and thereby prevent further dangerous climate change. And then there's adaptation, which is preparing for the inevitable changes and threats that will result as a result of prior emissions. And so, not unsurprisingly, places that are interested in mitigation and open to that are also preparing and doing adaptive planning. There are several places in Europe that have really done a good job of coming up with climate action plans and developing national strategies for reducing their carbon footprints. The world over, countries are finding it more difficult than they had expected to meet the targets that they've set for themselves. And countries that have a robust public health infrastructure, like the United States, have an easier time with the adaptation challenge than other areas that don't have as much invested in their public health infrastructure. But
so that would, excuse me for
Sure.
that would explain a little bit our reluctance, because there's not an immediacy here that there might be elsewhere?
I think that's one part of it, potentially, that we do feel confident that we have an infrastructure that can handle significant emergencies. But I'd point out that we've been tested and failed pretty miserably in certain instances. You know, while Hurricane Katrina, we can't attribute Katrina to climate change, we can certainly point to it as a prototypical major weather-related disaster that had horrific consequences for a large portion of our population and caused major displacement and catastrophic economic loss. And so we've done better with subsequent hurricanes, and we have the capacity to deal well with a lot of different public health threats, but we have to anticipate them and put in the resources ahead of time to make sure that we're prepared.
This is probably an unfair question to ask you, but where do you think America or North America will suffer the most? Will it be the coastal areas because of the sea rising? Will it be the breadbasket because of drought? Or will it be the desert area also because of drought? Are you able to predict it all? what you think will be worst hit, or should we prepare for everything?
Well, at some level we should prepare for everything, with the caveat that climate change, the effects of climate change are very place dependent. So there are several hotspots, like I mentioned, the cities, low-lying regions, the areas at the edge of vector-borne disease range, the Arctic, the islands. Certain places are more prone to having health consequences. And then within those places, there are certain vulnerable populations. So we need a robust public health infrastructure for several reasons. And a lot of the public health activities that will help mitigate and adapt to climate change are also helpful in other areas of public health. But we can focus in on certain areas. We can focus in on vulnerable populations in our cities, for instance, to prevent heat-related illness and death. So there's a range of places, and I hesitate to say that one area of the United States or one group will be more affected than others. I think there are several threats in several areas, and with such a large country, with such a diverse range of ecosystems covering such a large area, geographically it's difficult to say where one will be more affected than others.
You mentioned a few minutes ago that one of the reasons we're lagging behind is we have such a good infrastructure of public health, so we're not suffering maybe so much. But there have to be other reasons. Is it a mindset? Is it the complication, the fact that the information is very technical and complicated? Are we limited in our thinking? I mean, what is it that has made us lag behind so far? I mean, I hate to think that it's just greed.
Right.
And, you know, I think that's probably a large part of it, that we are so wedded to capitalism and growth and progress being our creed that comes first. Your thoughts on that?
Well, I think there are several reasons that we're limited. Less so now, but in the recent past, there's been some active misinformation that's been promulgated about climate change and the effect of emissions from combustion of fossil fuels. And so I think a lot of people have been misinformed. And so we've come a little bit late to the dance in that sense. I also think that it is very complicated. It's technically difficult. It's difficult to understand the climate system in the Earth. We don't have as much evidence as we'd like sometimes to fully understand why things are happening the way they're happening. And then with climate and health associations in particular, we just haven't looked as closely as we might have. So sometimes we have to hedge as scientists, saying, well, we don't know exactly what will happen. We can give you a general sense, but we're waiting for more evidence to come in, and it's very complicated, and the systems are complicated. I think another part of it is that it's scary for people to think about, and people don't particularly want to embrace some of the sacrifices that might be required and lifestyle changes, but they also don't want to think that they're handing off a severely damaged Earth to their children and grandchildren. They don't want to shoulder themselves with that burden. And some of the changes that we expect are frankly outside of our experience. And so it's hard for us to say, yeah, okay, I've been through a heat wave. It wasn't so bad. I certainly didn't die, and nobody I knew died. But a 3-day heat wave is different than a 3-month span where temperatures are 115 to 120 degrees daily. And
you lose power.
Yeah, and you lose power. And then that's not anything that most of us have experienced.
I wonder also if it's that we as a culture, we are so, we believe so strongly in technology. That always seems to be our answer for everything, and it is one of the things we've made the most progress in. And our relationship to nature is almost secondary, I think, to that belief. And therefore, we think that we can tame nature. It's in our religious tradition that we have dominion over the planet. And so I think people maybe can't imagine that this planet that we've had dominion over for so long, and our technology might fail us because these changes might be bigger than what we can handle. And sometimes I think people just, like you said, can't put their arms around this concept. very well. It's too scary.
Right.
And outside of our experience, maybe.
And I think you're right that it does pose a very difficult technical problem. And we won't see our way out of this without significant technical innovations, though we already have a lot of innovative technologies that can help us limit our emissions significantly. But I have to say I don't see on the immediate horizon the technical innovations that we need to continue living exactly as we have, burning through 25% of the world's fossil fuels supply every day in the United States. It's a very difficult challenge, and so far we don't seem to have the technical resources to.
Well, maybe we don't have the technical resources too, but I'm not sure we've reached through to people yet to make them recognize that giving up their 2 or 3 cars or driving less or, you know, turning the air conditioning on, whatever it is, that it really matters that much. And it may be because global warming sounds kind of benign, which is first what it came out. I mean, even I thought, oh, I like the warmth, I hate the cold. So, you know, so I don't know that, but climate change is a better term to use. I think it makes people think bigger.
And it's more accurate because we're not only seeing warming. In certain places there'll be cooling, in certain places there'll be new hazardous weather events that weren't there before. So.
Right. What about the role of public health agencies? Is it their role to educate or just to be prepared?
Well, there's a host of different functions that public health agencies play, and at CDC we've examined this carefully and identified a host of different functions that we want to play, and they include increased surveillance of climate health associations and climate health and diseases that are climate sensitive. We also have invested heavily in outreach and public awareness to let people know about the public health effects of climate change and to prepare a new public health workforce, to give them the skills to better understand climate modeling and climate health associations and health communication around climate change. It's a really new health communication problem for us. We have been fanning out across the country to do talks and gather input from the different state and other agencies or do public health work on the ground and supporting their local public health activities because, again, it's very place dependent. And so increased surveillance and education and outreach are fundamental to the public health response.
I know that the AMA recently passed a policy aimed at educating the medical community on the adverse health effects of global climate change, which is a great thing. I think it's late. I mean, it seems like it took them a long time. It's admirable that they've done it, but it seems like it's late. So I'm hoping that maybe that's a trend and they're starting now, and that will spread, you know, become more widespread. What should communities like Tucson do to be prepared for this?
Well, around the country, we've seen a pretty robust local response. And again, place is very important. So climate change is largely going to amplify the public health problems that a particular community is already facing. And so when thinking about how to prepare, the local public health community needs to think about the underlying health problems and how they'll be exacerbated by climate change. So developing climate action plans that anticipate heat waves or other weather-related disasters, thinking through scenarios wherein there are multi-system failures. So, for instance, a severe heat wave and then demand on the power grid that overwhelms transmission capacity. And in coastal areas, for instance, looking at critical infrastructure that's located near the coast and could be inundated by surge. And so preparing to preserve that critical infrastructure, preparing for evacuations as necessary, doing enhanced surveillance for climate-sensitive diseases that are in the area, promoting green building codes, green roofs, dense urban building, cooling centers. There are a whole host of different interventions that are proven, and what to adopt depends on where you are and what the threats are. Investing in that local public health preparedness will really pay off.
Quickly, because we're running out of time, I have two more questions. What's the most important thing we as individuals, in your opinion, can do? One or two words, if you can.
One or two words, the most important thing you can do. Well, we have a mantra that we've developed at CDC that sums up several concepts. One is be prepared, eat differently, travel differently, and go green at home and work.
Okay. Again quickly, sorry about this. Are you optimistic or pessimistic that we are going to meet this challenge?
I'm optimistic. I think it will be very difficult, and I think we'll have some rough roads ahead, but I think that we have the capacity to do it. We have no choice.
Well, I know we have no choice. Now, when you say we, are you talking we, the United States, or we, the world?
Well, certainly we, the United States, and I think that we can become a global leader in this effort.
Oh, I think we need to do that. Dr. Jeremy Hess, thank you so much for joining us.
Thank you.
Very interesting, very informative. And I want to thank all of you for joining us, too. I hope you found the program as interesting as I did. And as always, I'm going to leave you with a quote. This is by Dr. George Benjamin, Executive Director, American Public Health Association, in November of last year. Climate change is one of the most serious public health threats facing our nation. Yet few Americans are aware of the very real consequences of climate change on the health of our communities, our families, and our children. Thank you again. Thank you.